Good morning, good afternoon, or good evening, everyone. Thank you for joining this session on evidence-informed advocacy for health, an approach to ensure the effective adoption of evidence-informed policies. I will be leading this workshop session with Ms. Rana Saleh. I will introduce Ms. Rana Saleh and talk a little bit about myself and start the session. We have 2 hours. We have timed the session to go on for around an hour and a half, and then we'll have time for discussion. And also we will call on you as we go through the material to engage with us via the Q&A live through the platform. And so please feel free to engage in that platform. First, to introduce myself, my name is Rima Nakash. I'm a professor at the Health Promotion and Community Health Department at the Faculty of Health Sciences at the American University of Beirut, and I am Associate Director of the Knowledge to Policy Center there. I have, in addition to my focus area of research, which is tobacco control policy, I do research in community-based participatory approaches and implementation science, and I've taught the competency of advocacy to our graduate public health program for many years, which is now actually has become a core competency that all graduates in public health need to take at the school. And I'm happy today to be running this session with Ms. Rana Saleh, who will join us in a while. Ms. Rana currently is a PhD student at McMaster University in health policy. Prior to that, just recently prior to that, she was the advocacy and evidence lead specialist at the Knowledge to Policy Center in the American University of Beirut. And we've worked together on a number of public health policy advocacy projects. And so we will be running, as I said, this session together. I will move forward to the next slide. Just as an outline, I will go through a few slides fairly quickly to review what advocacy is, and then we'll move through various examples, looking at how and which topics are appropriate for evidence-informed advocacy, and go through the processes of stakeholder and mobilization, including how to conduct a power analysis, which is a very critical tool for advocacy, and moving to strategy development, tool selection, and do a few of reflections and take-home messages, and leave time for us to exchange any comments and any feedback from you, from your experiences also in public health and in advocacy. So just to start, we thought that it's a good place to start with this impact-oriented approach to knowledge translation. Now, there are many knowledge translation frameworks that are available, and we wanted to illustrate this point and this framework to show that, in fact, knowledge translation is an iterative process. But most importantly, it needs to be an impact-oriented process, which means that the entire knowledge translation process should be driven by the results or the outcomes that we are expecting. And more importantly, that it's a continuum that it starts at one point, at the point of priority setting, and moves all the way to down the policy cycle to research agenda, implementation, and policy and evaluation components. And this framework that's been published by Dr. Jardali and Ms. Fadlallah, who are, Dr. Jardali is the director of the Knowledge to Policy Center. The framework actually builds on prior knowledge translation frameworks, and it includes an aspect that is very important, which has to do with capacity building and making resources available, and the requirements of a resource in order to promote knowledge translation at various levels, at the individual level, at the institutional level, at the researcher level, and system level. So we will be talking more specifically, focusing on advocacy, where it is at the knowledge uptake phase. and levels. So focusing more, always talking about evidence-informed advocacy, and you will see that we will be referring to that throughout the presentation. But to start with, why advocate? Because research by itself does little to affect change, and there has to be an active process which we need to be engaging in, and we will talk later on that this is a process that not only researchers need to be engaged in, but other stakeholders, and we will be discussing that. But many of you might be familiar with this diagram that actually has been published a while back, and it just we like to show it to remind ourselves that when we talk about the need for advocacy, it's important to remember that advocacy is, the value of it is that we know that a lot of research is produced, but very little of it is taken up, and that very often the research is wasted. And so in this publication, they actually reported on when 50% of studies fail to take adequate steps to reduce biases, or example, unconcealed treatment allocation. Many studies actually don't reach the publication phase. Many studies, even with disappointing results, don't get published, which actually bias the research production process. And so one way to move forward and ensure that evidence that's generated is taken up is through advocacy. So what is it? It's a process by which individuals or groups work together and try to bring about social or organizational change on behalf of a particular identified health problem, program, interest, or population. What are the features of advocacy? We can think of a number of features. First of all, it's not just another word for publicity. So writing about a research finding or acknowledging publication of a research finding, for example, in the media, is not what advocacy is. There are other aspects that we need to be able to identify in order to be naming it as advocacy. It is always issue and policy oriented, looking more at upstream changes. How do we change upstream level policy changes, and not focusing on individual behavior or individual level change. Very often advocacy is around and is needed around contested debates where there is very clear opposition. So we find, if we look in the literature, that many non-communicable disease issues such as, prevention of obesity, alcohol harm reduction, tobacco control, issues where there are strong industry opposition that have created debates. Those are the issues that require and would require advocacy. And opposition can include active opposition, but also apathy or indifference to any issue is by itself non-conducive to change and impact. And this is where advocacy is needed. And very often it is run by campaigns that are by a few number of people with very little resources. This is why it's important to advocate for advocacy, to raise funds so that those groups can be supported and the sustainability of advocacy activities and campaigns and successes can be taken up. A very important aspect of it is that relies on engagement and partnership, that different partners bring in different skills, credibilities, accountabilities to the process. And it's very important to think about, when we think about advocacy, to think about that. Why and when would you choose advocacy? You would choose it in situations where, okay, you want to promote a public health objective. There are barriers that are restricting this objective. There is opposition, and you are working on turning a certain agenda to get closer to a policy outcome or a public health policy outcome. And so it's very important to think about those aspects when you think of identifying topics that are needed for that advocacy is needed for them. So what are the characteristics of a good advocate? Of course, knowledge and evidence, and knowledge about the topic, and we will talk later on about how it's an iterative process, that knowledge changes, evidence, also evidence changes, and evidence is actually, we look at the best available evidence and data at a point in time. But what we think of as an ideal advocate is with high knowledge, but also passion and drive. And that's what is a good characteristic of an advocate. And when we have both, the likelihood of moving forward in a successful approach is. Very importantly, and that comes up many times, even in classes when I'm talking about advocacy, it's important to be aware that there's no blueprint or absolute answer to how each issue is approached. It depends on the context, it depends on the partners that are engaged, it depends on the time and the policy window in which this particular advocacy campaign and not only at the evidence available at the time that you start your advocacy campaign, but what is the evidence that's being generated, or if there's new evidence that comes up, how are we able as advocates to engage in this evidence, take it up and use it in the campaign. We will be following this advocacy framework that we put together at the Knowledge to Policy Center, and going through sort of the steps necessary to go through when we want to develop an advocacy campaign, starting with thinking about the topic. What are the topics that we need to, how do you select a topic for advocacy? How do you decide that this topic will require advocacy? How do you form the team that's necessary to work within? And then the process of mobilizing stakeholders, conducting a power analysis, and then thinking, given the outcomes of the power analysis, what are the appropriate strategies and tools that as a team you need to be developing, and then thinking about evaluation of the whole process. So we will be moving in this 2 hours, hour and a half that we have through this phase. When we think about selection of the topic, we think about level 1 evidence as defined by Dr. Brownson, who has published on evidence-informed public health. And level 1 evidence is there evidence that there is a problem? What's the size of the problem in the context that we're working in? What is the data that we have that can give us information about patterns of occurrence? What are the risk factors? What are the causal consequences? What do we know about the cost of this public health problem on healthcare and social cost? It's very important information that is that we need to decide on the topic, and it's also very important information that will be valuable for us when we move forward in our advocacy campaign, and we will be using it, and we can use them in the messages that we develop. So what is the evidence on the factors, the underlying factors at all the levels? Who are the key stakeholders, whether they are health or non-health related? In many instances, in those advocacy campaigns, we need and we have to engage in the non-health sector, and stakeholders that are outside the health sector. Who do we need to engage in, and what has already been done on the issue? If there has been any previous advocacy campaigns on this issue, or previous policies, intervention initiatives that have been developed in the context that we're working in, what are they as sort of baseline information as we think about how to move forward in the topic? Are there policies that are already out there that are evidence informed and there is no need to advocate for our topic, or is there more recent evidence that we need to look at and observe? So thinking about through the policy cycle, at what point do we need to, what is our focus of our advocacy campaign? Is that topic that we selected not yet identified as a problem? Do we need to move forward in advocacy to put it on the agenda? Or is it more about, it's already on the agenda of policymakers, but is it more about formulating the policy and making sure that the policy is informed by evidence? At what point of the policy cycle do we need to be focusing in? And very often this is very helpful to be able to identify that, because that defines the scope of the campaign that is needed for the specific public health issue. It could be that we define our campaign, and the objective of our campaign is focused on policy formulation, but we also take into consideration policy implementations and solutions and advocating for later on enforcement of policy. Okay, so what and how of the solutions? We identify relevant solutions. How are these solutions identified? This is level 2 evidence, what is out there and what has been accumulating in the literature on the solutions to the problem. What can we find about effectiveness of the solution? Can we find anything published in our context or other on the evidence of the implementation process? What are the benefits, harms? What are the potential barriers? If there is any implementation research that's been conducted that has identified barriers to policy implementation, and what are the ethical considerations to the approach, to the solution, to the public health solution that we are aiming to advocate for. We rely, of course, in identifying the evidence on peer-reviewed articles, but most importantly, we rely on systematic reviews and meta-analysis, if there are any on this topic. We try to rely on the best available evidence in the various databases that provide the synthesis of knowledge. And if you remember the framework that I showed, one step back before reaching the point of working on knowledge uptake is identifying this evidence and what is available in the international literature. Sometimes you are able to identify evidence specific to a region and specific to a country or at a local level. So there's an extensive process and time that needs to be put in identifying these solutions and what works and what doesn't work, what's been evaluated, and what are the issues that we need to advocate for more specifically that fit the context that we work within. So before we move on to the next stage, and you will find that every step that we go through towards the end, we will seek to engage you in the chat option on the platform. If you can add through the live, the Q&A platform and share with us. So thinking about what I said so far about what advocacy is in the field that you work with, in the public health, as a public health professional, what are the topics that you think would require advocacy, or what are the topics that you work on that you have up till now in the session thought that would not require advocacy, and why not? And through these topics that you think about as we go through and talk about policy analysis and identifying stakeholders, keep that topic in your head and think through what could be various answers that come to your mind as you go through the various steps of advocacy. I will hand in now the presentation to my colleague, Ms. Rana Saleh, who will be talking about step 2 in the process, which is impact team formation, and then moving through the various processes as we go on. Hi, Rana.
Hello, everyone. Thank you all for joining.
So I'm controlling the presentation, so you will have to say next to me.
Okay, no problem. So thank you so much for the introduction so far. It's very important to understand the issue from all of its angles before we move forward. If we don't have the proper understanding, it will be so difficult for us to manage the next steps and to choose the right people and the right times to engage people. One of the most important steps while advocating is advocating in groups, because a golden rule is that you can never advocate alone on any topic. You always have to advocate in groups, have supporters on your side. Who is the impact team? The impact team is a multidisciplinary team convened to provide the guidance for you on the next steps. Who are the stakeholders you should be engaging? What engagement approaches? What is the content of your advocacy campaign? Who you should approach next? And so on and so forth. And this is not necessarily a coalition. It's more like a small team of probably having a lawyer inside, a content expert, and a communication specialist, only few people, so that it would be manageable to have meetings always and discuss. Ideally, you should have monthly meetings in order to move together on the next steps. Next. Together with the impact team, you have to decide on who are the stakeholders that you should be engaging. But before realizing who are the stakeholders you should be engaging, can I share my screen? Sorry. Okay. It's working now. So before realizing who are the stakeholders you should be engaging, first we have to know why we should be engaging from the first place. So the most important aspect of engaging policymakers is that they will allow you to get the tacit knowledge that you will not find in any report. And what tacit knowledge means, it means the experiential knowledge that you will not find in reports nor in published evidence, and no one else will tell you other than them. So it's very important to get their feedback on what works in that context. It would increase their buy-in, especially if you're engaging them from the start. Whenever you engage with stakeholders right from the beginning of your campaign, you have better chances for them to own the project with you, and as such increase their buy-in not only for the adoption but also for the implementation of the policies. And even if you get out of the team later on at a later stage, at least you will have people who own the project with you to continue. This will lead to sustainable implementation of policies and interventions as well. Similarly to the influencers and other key stakeholders. So it might not be a decision maker who are you engaging necessarily, but other influencers who can influence the decision-making process in various ways, such as NGOs, national and international organizations, researchers, media, and so on and so forth. Again, because you need their tacit knowledge, you need their buy-in, you need the sustainable implementation, but most importantly, they could be advocates supporting you in your campaign. They could be members of your coalition. And if you engage with them early on, that will help you to increase your area of coverage and also the scope of coverage of your campaign. The public. The public, it's ideal to engage with them. Why? Because it's their right before anything else. It's their right based on the human right, Alma-Ata Declaration, and also the Sustainable Development Goals, highlighted the importance of engaging public in the decision-making process. Why it's important? Because it definitely has been shown in evidence that it leads to the development of policies and programs that are sensitive to their needs and priorities. It will improve public education and also policy implementation and compliance. And it can enhance accountability and transparency, and also empower citizens. So now just to review what we have. What we have now is a proper understanding of the problem, of the solutions, and also of all the underlying factors behind it. We also need to understand who are the stakeholders, but the proper understanding of the stakeholders does require extra steps from us. And ideally, that will happen through a power analysis tools. What is power analysis? Power analysis is a tool that you can use to identify key decision makers and others who have power over a specific issue, as well as those who can influence them. We will go through the power analysis exercise in a bit of details, and then we will share an example with you to illustrate how to conduct a power analysis and its importance. So what is the importance of a power analysis? It really can help us to map who are the stakeholders, map the scope of the stakeholders who are engaged in a certain issue. So how many, is it that there are researchers, NGOs, religious leaders, probably, municipalities, who are the stakeholders who are involved. These tools will help us to map all of those stakeholders. And then it can guide us through revealing their power and identifying who would be our allies and who would be our opponents. Ideally, the proper understanding of the stakeholder and the political landscape will help us identify the best contextualized solutions and the framing of those solutions. And this is very important. And I will go through examples of why framing can be very important. Why power analysis? Power analysis is very important because it can help you identify who are the key decision makers, and it can also help you to make the right decisions in strategic issues. So how would that would be possible? Once you identify who are the key stakeholders, for example, who are the policymakers who have been supportive of this issue, and what is the framing that they use? What is the reasoning behind their support? And what are the stakeholders that are against this policy? And what are the arguments that they use against this policy? What are the framings that they use against this policy? What have they done before in order to show us that they have the power in this landscape? And that is why we would know that we should engage with those people. That's how we should know what framings we should use and what counter arguments we should use in our advocacy campaign in order to win, if you want to say win, quote unquote. And definitely that will build a better understanding, a successful advocacy work, and hopefully impact on public health. So how to do it? How to do it? First of all, you have to do your basic work, which is checking all the evidence available. Check who publishes on this work a lot in your context, or even in your region, or in other contexts that might be similar to your region. Check who are the policymakers and who are the entities that are at stake in this issue. So for example, if you're working at schools, you definitely have to go through with the Ministry of Health. If you're working on a topic related to any industry, you have to engage also the Ministry of Industry. If you're working at a national level, or if you're working at a local level, you have to know who are the stakeholders involved in this issue. How would you know that? Simply by getting a sense of the reports that has been published about this issue, about the evidence that has been published about this issue, and most importantly, media coverage. Media coverage can tell you most of your strategy and how to move forward. Basically, we rely on media coverage and probably even social media accounts of those stakeholders a lot through our campaign. Why? Because it could tell you the values of those stakeholders and the arguments that they use and the arguments that you should form against their arguments. So it's very important to do all of this background check yourself. If there is anything missing yet, you have to go through some stakeholder meetings. Probably go with some people who you think they might be supportive of your campaign, but who have more connections and more relationships or more experience in the field. And then you can get a sense of their opinion about the stakeholders and who are the most important and what are the appropriate framings and arguments that people are using. Then start snowballing from there. Once you have the proper background information, you can do an official power analysis exercise. How to do that? Mainly, you have to engage with stakeholders who you believe are important in this situation, who have some experience on the ground and who can tell you a bit about the details that you did not find behind your computer. Together, you can work on this power analysis where you analyze the position of the stakeholders from this situation or from this policy, and also their power. And we will define power in a bit. When to do it? It's very, very important to conduct the power analysis at multiple stages in your campaign. Why? Because it will provide you with a sense of where you were and where you are, and that could be a powerful evaluation tool for the impact of your work. So if you knew before that at least 5 stakeholders were in opposition, and at the end of the campaign, you had 3 in opposition, then you would know that those 2 are actually now allies because of your campaign. And that's how you would know the impact of your campaign. It also helps you re-strategize. So sometimes an important event happens or a focusing event happens, and then a certain stakeholder changes their position or changes their power, or there is a cabinet change or there's an election in your government. And then you have to change and re-strategize because the landscape of the stakeholders and the landscape of the power of the stakeholders has changed. Maybe the previous minister was not supportive, but the current minister who is now appointed is supportive, or it's vice versa. So that's why it's very important to conduct this power analysis exercise regularly. How to do it? There are mainly 3 stages. First of all, it's the regular mapping of the stakeholders. Who are the groups or the organizations concerned in your advocacy strategy? How would you know? Simply from the steps that we've identified before, and mainly from monitoring the media. Ideally, you would segregate them as public, influencers, and policy and decision makers. Who are the public? They are the vulnerable groups mostly affected by the problem or also the solutions that you are recommending. Who are the influencers? They are not necessarily decision makers in that sense, but they have a power and they have a say, and they are important in this situation. So for example, these could be NGOs, advocacy groups who are working already on this issue, religious leaders, media, private sector, researchers, professionals in the field, other organizations. And depending on the landscape of your country, you could add a lot more. Who are the decision makers? The decision makers who have the powerful say. It might be just people in ministries or parliamentarians or the prime minister or even the president, but it also might be even the decision makers at a local level. If you're working in schools, principals the decision maker, if they have the power to make the decision. And also local community leaders can sometimes be the decision makers and not only the influencers. So it's up to the problem that you are working on to define who are your decision makers. Ideally, you would have, for example, governmental organizations, parliamentarians, municipalities, governments. Judiciary system can be very beneficial in some contexts. And also orders and syndicates can be extremely powerful in some contexts, while in other contexts they are not. The second stage, after you've identified all of those stakeholders, it's now time to know their power. And when we talk about power, there are multiple definitions of power. Ideally, what would make a stakeholder powerful? It would make a stakeholder powerful if they have resources, financial, human resources, and also technical abilities and technical skills. They would be powerful if they have access to policymakers, if they have connections to policymakers and decision makers, and they are in good terms and relationship with them. They would also be powerful if they have access to media, for example, or have access to other groups that are important. So those are some of the thoughts that you could, or questions you could ask yourself when identifying the power of the stakeholders that you are mapping. These are some questions that would guide you in order to identify the power and position of some stakeholders. For example, which individuals or institutions have the power to give you what you want? Who are the key decision makers? And who can make your requests happen? Think of your problem and think of the solutions when you're thinking about the stakeholders. So for example, if your problem is, as we will share in our example, is schools, is childhood obesity, and the solutions are in schools, and one of the solutions are related to product reformulation, then you have to engage with the Ministry of Industry, and you have to engage with the industry themselves, or not engage with them, but at least have them as stakeholders mapped. So think of your problem and your solutions while thinking of who are the stakeholders that you should be adding to the list. Who are the allied organizations that will be fighting the same fight with you, who have a history in advocating for this issue, and who might be allies with you? How powerful are they? Were they able to change any policy before? Were they able not to change any policy before? Do they have access to policymakers? What assets can they bring into the table? Do they have the money? Do they have the time or the exposure? Or do they have a very large volunteer base who can be the people who are advocating on the ground? Or do they have just the expertise or the brains that could give you the technical skills that you need or the technical information that you need? So those are all important questions that you should be taking into consideration when identifying the power of those stakeholders. And think of who will oppose you and who will they partner with to oppose you. So for example, in the case of tobacco control in Lebanon, our main opposition, or the main opposition for that, are not only the industry, but also the syndicate of the hospitality sector, restaurant owners and hotels and so on and so forth. So these are considered as partners and opposition in your campaign. So you're not only thinking of the tobacco industry, but you're also thinking of other allies who might oppose you. And then how much can they affect your activities, or how much can they really affect change? Have they done any change before? Are they influential? Have they changed any policy before? Have they blocked any policy before? These are very important questions to ask. This is the power analysis scheme. There are multiple schemes available out there that you can choose. This one is my favorite because it reduces the confusion while plotting the stakeholders on it. So for example, here on the x-axis, you have allies and you also have opponents, people with low influence and people with high influence. So ideally, if you have an ally, then they should be around this side, around the right side. And if they were able to change a policy before, or if they are even considered a decision maker before, then you would consider them higher in the influence. If they were not able to change any policy before, if they're not decision makers or their power is not that much, then you would get them on the lower side of the influence. Similarly for the opposition. And this exercise ideally should be done with stakeholders to support you at multiple stages. To guide your work, you can also try to have a scale here if you find the scale helpful. So for example, from 0 to 5, and also from 0 to 5. And that would help you identify the position of the stakeholders around here. We will show you an example in a few so that it becomes easier to grasp. Once you identify and map all of those stakeholders, now you can categorize them. The ideal categorizations will ideally help you identify who are your opponents and who are your allies. So all of those who are in the upper right quadrant, they would be the allies, and those you should always keep engaged with them. Ideally, you would form a coalition and work together with them. Those who are in the upper left quadrant, those are your opponents who you should be keeping interested, who you should target in your advocacy campaign. Those are the people who are also opposition, but they are not that influential. However, you have to continue to monitor their work just in case they organize themselves and they are more powerful than they used to be. Similarly here, those are the people who are helpful, who are supportive of your campaign. However, they are not of that high influence. You would choose, for example, to have some campaigns to get these people organized to help you in your campaign. So ideally, after you have identified your targets and you have identified your opposition, now it's very important to understand this opposition, to understand what they have done before, and to understand what tactics and framings that they have used before. You could simply check the media. However, this is an article that we really suggest that you go through. It will provide you with a taxonomy of the different tactics and different framings oppositions usually use. This framework has been tested on issues such as the tobacco advocacy, alcohol, and also the food industry. And interestingly, though, that all of the industries and the oppositions there are using similar tactics and are using similar framings to counter public health issues. So if you understand those tactics ahead of time, you can preempt them and you can also find counter arguments for their arguments. So it's very important to understand this opposition and study them really well and know their strategies, their strength, their tactics, and their framings. With the allies, ideally you would form a coalition. Aim not to have it as a big coalition because it will not be manageable, and aim for monthly meetings in order to establish rapport and ground rules, and also decide on your next steps and strategies altogether. So share with us on chat who are the most important opposition that you face in your field of work or even the advocacy work that you work with. Do we have any thoughts? Because I can't see. Feel free to share with us the topic that you are working on and the main opposition that you are facing.
People are sharing as you go along with the presentation.
Okay. So shall I continue or do we have any thoughts? Okay.
Continue, I think.
So the next stage, after you have identified all the problems that you should be tackling, the solutions, and you have also identified who are the various stakeholders you should be dealing with or where you should be engaging. You have also got a sense of framings that might be more acceptable in your context. Now it's time for the strategy development. And really, it's as any other strategy. So if you know how to develop any strategic plan, this would be easy for you. However, it has some nuances that we will share now. So first of all, you have to identify what is the goal of your campaign. Is it to set the issue on the policy agenda? Is it to promote the adoption of those policies? Or is it to promote the implementation of an existing policy? What is it? You're advocating for a certain policy, or it's a comprehensive policy, or it's an increase probably in financing of a certain issue. So what is it that you are aiming at from your strategy? Are you planning to have more support from stakeholders, from policymakers, or maybe more support from the influencers, or all together? So you have to decide together with your coalition on your advocacy goal. Where do you want to be ideally from this campaign? And then choose the target audience who are important for your goal. And then after that, you have to identify the change that you want to have for each stakeholder group. So, and then once you do that, you have to identify what are the tactics or the activities that you should be doing in order to reach to the change that you are pursuing. After you have to identify the expected outcomes, what are the communication tools and the evaluation tools. Don't worry, we'll go through this in a bit of detail in a few. So once you've identified your goals, who are your targets? Are they the public, the influencers, or the decision makers? And what is the expected outcomes? Is it that you have identified that the public have limited awareness about this issue? Or maybe that the influencers, they know about this issue, but they don't have the will to work on it. So you need to work on the will. Or maybe is it that the decision makers, they have the will, but they have not engaged in the action, or they don't have the will. So you have to identify what is your change pursued per stakeholder group. Once you find that, you can now know what is the tactic that you want. So those in the boxes in the middle are the tactics. So for example, if you're working on public awareness, then you could have public education campaigns, public awareness campaigns, voters outreach, public polling, surveys sent out to the public. There are multiple ways that you can raise the awareness of the public. If you're working on the will for influencers, for example, you can work on a leadership development campaign, building their advocacy capacity, community organizing, or having other media advocacy campaigns. Similarly with the decision makers, if you're working, for example, on their will, then you can work on the champion development, political will campaigns, and have public forums of discussions with those decision makers, and so on and so forth. So those are only some examples that illustrate some of the tactics. There will be a lot of tactics shared again throughout this presentation, but I also urge you to check the reference list because there are some resources that have tens and dozens of tactics, and they're all defined with some examples of how they've been used before to provide an illustration of those tactics. This is a broad definition of some of the tactics involved here, but again, there are multiple more that you can use, and really the sky is your limit. You can develop your own tactic. You can choose what tactics have been used in your context and have worked on the same issue or on different issues. You can know better which tactics you should be using depending on the context, your resources, the time availability that you have, and previous experiences. So now that you have identified the tactics, you need to know the tools, right? So if I'm aiming for a media advocacy tactic, then what are my tools? There are mainly Facebook posts, probably Twitter posts. There are newspaper articles, maybe media interviews on TV or radio spots. So those are the tools that you should be using. Those are some examples also of tools that you can check for your stakeholder groups. So for example, if you're dealing with experts, then probably you can go with some policy studies, conferences and presentations, data visualization techniques, and so on and so forth. If you are working with informed non-experts, then you would probably have some videos, have some data visualization techniques, and other easier material to grapple with. If you're working with the general public, ideally you would go with the media, campaigns, speeches, and so on and so forth. And this is just to illustrate that there's so many different ways that you can advocate with, using so many different tactics, activities, and tools. And this is the reference that we are referring to, which is a book by Chapman that he developed based on his advocacy campaigns while fighting for tobacco control in his context. So, for example, be there for the events when the opposition is speaking through a press conference. You could be one of the audiences asking one tough question for them. You could boycott, for example, if you're working against industries. You could develop or form demonstrations. You could do the screen test. The screen test is a fun test where you would, if you have multiple solutions, try to promote one of the solutions. If they fight you back, then you know that this solution works, and that's why they're fighting it. That's why it's called the screen test. So they will only scream if it hurts. You could also engage through media. Now it's useful to engage with some influencers, social media influencers, or singers or celebrities who can really widen the scope of your campaign and reach to a very wide base, if a wide base of the public is important in your case. Of course, evaluation is very important, and that's exactly how you'll know if your campaign is working or not. You have to evaluate the process, and you also have to evaluate your outcome. So definitely based on your goals, on your audiences, and on the tactics and the tools that you've chosen, you can develop your own indicators. So this slide here is only an illustration of some of the indicators that you can be thinking of. So if you're, for example, aiming to have a stronger coalition, and then the number, type, and the strength of the relationship with the partners could be of the meetings that you have with this coalition could be one of the indicators that you could assess the strength of the coalition that you're having. So those are only some examples, but you can develop your own indicators. And any evaluation ideally is better than no evaluation. And after that, of course, you have to monitor your work to see what the stakeholders respond to your advocacy campaign. Monitor the media to see for responses. Ideally, they would respond promptly to your campaign if your campaign hurts them. And then you could invest also in partnerships and use your networks depending on what arises in that situation. So for example, we have reached out to our colleagues or partners who are media experts or who have connections in the media multiple times when we feel like there is a need to respond directly to the media. We have reached to other stakeholders who might have access to certain policymakers if we've realized that this policymaker is now important more than before. So always monitor and evaluate and discuss with your coalition members the next way forward. Also, if you would like, you can share with us some of the examples of the advocacy tactics and tools that you have used before. And after that, we will share with you one of the examples that would go through every single step through the way to illustrate it, and hopefully it will become clearer for you. Do we have anything in the chat?
Yes, Rana, we don't have a lot of engagement on the chat, so I think we'll leave time for discussion later.
Okay. Okay, no problem. So this is the fun part. This is the part where we will share how we applied this advocacy framework on the case of childhood obesity prevention in Lebanon. So we will go through every single step of the way, and then Dr. Rima will share her reflections, and then we will open the floor for discussions, questions, thoughts. We would love to hear the advocacy campaigns also that you are working on, and if you feel that those strategies that we're discussing can be useful for your work. So first of all, define the problem. We know that childhood obesity has doubled in the past decade, and we have multiple reports of the harms that these have caused for children in Lebanon. In order to identify the solutions, we really need to understand the underlying factors first, right? So we know that childhood obesity is multifactorial, but we also know that in the case of Lebanon, there is a lack of a comprehensive national policy to address the obesogenic environment in schools. So this is one of the factors that can lead to childhood obesity. And we have also multiple fragmented initiatives by multiple NGOs and academic institutions who work on the obesogenic environment in schools. Once we decided that we want to narrow the scope on schools, it's now time to find the solutions for the problem of childhood obesity at schools. So we have done a systematic search where we identified more than 17 systematic reviews supporting policies inside schools in order to prevent childhood obesity. So there's really a very strong evidence base for school policies. Evidence is very clear on the situation that you have to have nutrition and physical activity education integrated in the curricula, coupled by a change in the school food environment where you remove everything unhealthy, add healthy, and also work on banning marketing. So those are the evidence, right? What we did there is that we developed a policy brief that has a comprehensive summary of this one slide. It's ideally, I don't know, it was a 60-page probably policy brief, summarized only in this slide, where we shared every single policy solution, the benefits, barriers, cost, the implementation considerations for every single barrier, and even the opinion of certain stakeholders that might arise from a certain policy solution. So we really now know the technical aspect of our problem and our solutions very well, and we have evidence-based answers of what should be done. Now it's time for the power analysis, moving forward into analyzing the stakeholders. And this is really the most fun part, at least for me. So this is one of the power analysis activities that we've done for this situation. We have identified influencers in blue, decision makers in green, and the public and local stakeholders in purple. So as you can see here, there's a lot of allies. There are multiple international and national NGOs, researchers, syndicate of dietitians, parents committees, order of physicians. All of those are allies with us. So how did we know? We checked media, we checked reports, we checked what is published out there, and we've asked that out. So it's very important to have connections when you're working on advocacy. So we've identified that all of these are allies. However, how did we define their influence here? How were we able to choose where they are from the influence or the power? Basically, it's based on how powerful they are and how effective they are in the change of the policy. So for example, for the school part of prevention, you have to have Ministry of Health and Ministry of Education. So as you can see here, they are the most influential. From media reports and from other interventions that we know that these two ministries are working on, we know that they have a lot of interventions in schools. And there is a strategic plan also for the both of them to tackle a school environment. to have a healthy school environment overall. And one of the issues within that strategy was also to have a non-opposogenic environment. So we know that they are allies and they are of high influence. Why did we engage with the Ministry of Economy and also the Ministry of Industry? Because one of the solutions was related to banning all the unhealthy or product reformulation. So those were now important stakeholders. We know that they are somewhat allies and they are influential, but they are not that of an ally because it's not really a priority area for them. So as you can see here, like just plotting those here on the power analysis, you could think of some strategies that you can use in order to get those stakeholders more of allies with you, to increase how much they support your cause, for example. Another important consideration when working on the power analysis is that you have to segregate the same category of stakeholders if you might have oppositions and supporters within it. So for example, you have principals and allies and also principals and oppositions. Why? Because some school principals benefit or directly benefit from the revenue that the canteens have in schools. So if you ban unhealthy and if you add healthy, the revenue will be reduced, and as such, those school principals might not be that supportive. So that's why you have to identify who are the stakeholders who really are supportive and who really are not. School nurses and students and other principals of the public schools, for example, they are not that powerful, even though they are allies. So it's very important to identify how powerful they are. So how likely is a school nurse able to change a policy in schools? In some instances, she or he can. In other instances, they have very limited ability. In Lebanon, they don't have that much power, but they are definitely allies. So that's why you would have them here in the low influence quadrant. Who are the opposition that appeared in our case? It was definitely the private food companies, and they are at the same power or the same level of influence as the ministries. Why? Because they were able to block change for so long. So we know that they are influential. Who are also in opposition? Local distributors to the schools. Canteens, definitely they won't like it. Some audiovisual media we've seen that they were supporting the private food industry, probably because they were receiving funding from them for advertisement. So there's kind of a conflict of interest here. Other researchers were actually commissioned by the industry to have some interventions in schools, and those are actually opposition because now they are researchers who are having conflict of interest in terms of this research, in terms of this topic. So as you can see here, that sometimes researchers can be opposition. Also, you have some parents and some students who might be against this. So as you can see here, once you plot everyone, you can know who are your allies and who are your opposition, and you can think of ideas on how to proceed next. So one of the main ideas that you would get is form a coalition with all the people who are supportive, right? Have some lobbying in order to get those in between to support you more, right? And try to reach out to those people who might change their position if they knew better, or if you provide an alternative solution for them that would not harm their revenue, such as the canteen owners or the local distributors. The private food companies, maybe just regulation by the government rather than tackle them with your advocacy strategies, because how much can you do? Well, it depends on your context. So this is just an illustration for you of the importance of the power analysis tool. And as such, from the proper understanding of the context of this case in Lebanon, we've identified that there are multiple initiatives existing at the level of schools, but they are fragmented. And there is a decree, or it's type of a law, but that's a ministerial level. It's not that powerful in Lebanon, the decree, and it can be changed by any minister who's in office, and that would pose some risk of conflict of interest, just in case the minister who comes along has any connections with the private industry, and as such they can change the decree if they did not like it. So ideally you would change a decree into a law that becomes so harder for any policymaker to change as they move on. And even the decree that was available has a lot of loopholes because it's only implemented in public schools and not in private. And in Lebanon, more than 60 to 70% of students are in private schools. And as such, there is no monitoring for the private schools beside the voluntary monitoring of some schools who decide or who opt for a healthy school environment. After the power analysis, we have identified that academic institutions, local and international NGOs, researchers, and experts are our allies that we should be working together on the advocacy campaign. The opposition were mainly private schools, some public schools who were not implementing the decree, the industry, and the ministries who were refusing to coordinate over the fear of losing some jurisdictions or authority. I'm sure that you face similar things in your context, but this is one of the main barriers in Lebanon for the implementation of most of policies. It's just a fight for jurisdictions between different ministries. The public seemed to be needing some education on the problems and the solutions, and they also needed to be mobilized because we needed a base to support our advocacy campaign and provide legitimacy of the claims that we are advocating for in front of the other ministries. This proper understanding helped us identify the goals for our campaign, which was to have the adoption of the evidence-informed policies that we were recommending in our policy brief. The objectives or the audience that we chose were everyone, because obviously if you're aiming for a complete rehaul in the schools in Lebanon, you have to engage with everyone. And that's why we wanted to work on the public will and also the public education, because it appeared to be a problem. And for the stakeholders or the influencers, they knew the problem, but we needed to work on their will and their action in order to change what was happening. And because we just wanted the adoption phase, or to advocate only for the adoption phase at that stage, we only worked on the adoption and the will of the stakeholders. So now you can see that this is our change that we were expecting, and those are the stakeholders. What we aimed for is the awareness of the public and also probably some media advocacy, community organization here. For the influencers, media advocacy, coalition building, model legislation. Model legislation is when you develop your policies with them, and ideally that's what we were working on in our policy brief, where they were engaging with us from day one in the development of that policy brief. For the decision makers, political will campaign, champion development, model legislation, and also some media targeting them. So as you can see here, we have now our goals, our stakeholders, the change that we need, and also the tactics. What's next is the tools. So what were the tools that we used in order to make every single tactic happen? So for example, for the community organization, we worked on citizen consultation events where we engaged with citizens from multiple governorates, asking them their feedback on the policies that we were suggesting. And then those suggestions from the citizens would be later shared with policymakers in order to provide legitimacy for your claims on the policies that you are working on. We also wanted to target the public with some media advocacy, and we opened up a Facebook page that had regular posts, on the issue of childhood obesity. So we were together, or at the same time, working on their awareness of the general public and also some community mobilization, where some of those people who shared with us their thoughts in citizen consultations were now advocates in their own communities. This is only one example of what a strategy would look like. And this is for the example of having a workshop for the public on building their advocacy capacity. So for example, here the goal is to create the public will. The tactic is building their advocacy capacity. The activity is having a workshop for that, for example. What are the communication tools? Are the tools that you are using in this workshop, the resources, the time frame, expected proximal and distal outcomes out of this advocacy workshop, and also what are the indicators that we have chosen and the evaluation plan necessary for those indicators. So this is really very much individualized based on what you are working on. However, this is just an example to illustrate how a strategy might look like on paper. Nothing happens, or not everything happens when you aim to change the paper into reality based on the context, the resources, the time frame that you have, and also the possibility given what events happen in your context. And we will share now in a bit what I mean by that. So this is an example of citizen consultations that we had. This is a summary of the policies. We did some data visualization for the policies that we were recommended to make it easier for the citizens to engage with us. And we provided a citizen consultation summary that was later used as a basis of the discussion with the national stakeholders in order to provide legitimacy for our claims. This is some of the media advocacy that we've done. Media interviews, social media posts. We went through Beirut Marathon, for example, had a hashtag that we asked people to engage with us, sharing it with parents, children, and so on and so forth, just in order to raise awareness of this topic and allow the public to talk more about it. And that's exactly what we needed. As for the decision makers, you could work for champion development, where you would have a high-level meeting attended by media, where you would choose some policymakers for them to champion your campaign in closed circles of decision maker meetings that you cannot attend. That's how you can have more buy-in for your campaign and also ownership. This is really, really powerful in a lot of situations. Model legislation, where we ideally shared this policy brief with the stakeholders, asked for their feedback, and they were engaged with us in a policy dialogue, engaged with us in media advocacy, and also we had a lot of lobbying with them. So this is an example of a national policy dialogue where we shared the results from our policy brief, from our citizen consultations. We had 7 ministries on that table. We had researchers, national and international organizations, parents representatives, teachers, school principals, and so on and so forth, in order to discuss all of the policies that we were recommending. This is the policy brief that we were sharing. You can find it online on K2P's website. And by the end of that policy dialogue, all of our policies that we were recommending were accepted by those stakeholders. And one of the major successes is that we had the 7 ministries all on one table talking to each other. And this is something that does not happen frequently in Lebanon. As for the influencers, we wanted to work with them together on the policy. So they were engaged with us in the development of the policy brief from the beginning, where they provided their feedback on the outline of it. And then they were engaged together with us also at the level of the dialogue. We also had a lot of lobbying and meetings with those stakeholders to discuss a joint implementation plan and so on and so forth. And we had some media advocacy in order to incentivize them to continue to work with us. As an outcome, we had more than 35 stakeholder meetings and lobbying mobilized from different ministries, professional organizations, universities, researchers, and so on and so forth. And you can't imagine the importance of lobbying itself in those meetings and raising awareness from those meetings. So just the lobbying fact raised awareness of the different efforts that were taking place. So whenever I would go to a meeting with a certain university and then I would go to another university, oh, by the way, did you know that the other university was also working on childhood obesity or in school policies? Why don't you coordinate? So just by the simple fact of sharing what was happening on the ground was really, really important in the case of Lebanon. It also raised awareness about the need to coordinate efforts between the different stakeholders who were working on the ground. And also, it provided a medium and point of junction and discussion, especially the dialogue, where stakeholders who never speak to each other before were now on the same table speaking to each other. And this forms a new lines of communication that were not present before, and that by itself is one of the very important impacts that you could have from your campaign. So it's not only about finding indicators and reaching to impact that you can measure. Sometimes the most important impact is the things that you cannot always measure, but they have an impact on the final outcome, which is the public health. It contributed to the speeding of the process, and as an outcome, this facilitated the development of a multi-sectoral committee at the level of the ministries that were involved in order to push forward for this agenda. And there was national childhood obesity prevention campaigns, and some school-level adaptation of the policies and procedures. What I was talking about earlier in terms of the events and what can happen, so all of this happened in early 2019. At the end of 2019 in Lebanon, there was a revolution. And this revolution basically stopped the work at the ministries and stopped the work in the government, and also in Lebanon specifically, at a larger sense. And then after the revolution, then came the COVID pandemic. And then the implementation of what the stakeholders agreed upon in that dialogue did not continue through, just because of the so many different variables that there were there. So as you can see, sometimes you can do everything right, you would reach the impact, and then something happens along the way, and that is just takes away from your impact. Or sometimes something happens during your events and then you have to re-strategize. So Dr. Rima now will share some of the lessons learned and the frustrations, how to deal with the frustrations sometimes. But overall, all of those strategies have been used and tested in various, and 2 topics at least, childhood obesity and also tobacco control, and they have proven to be very useful in that context. Over to you, Karima.
Thank you, Rana, for a very comprehensive presentation. I just want to summarize briefly the engagement on the discussion forum, and so to give other participants a chance to think about questions as we end our presentation. We had an actually live discussion mostly 3 participants were engaging. Patrick Wilson from NIHR UK, and I think he just logged off. He had to leave, but he was interested in learning more on how that has worked, or examples where that process has worked in health systems research. So if anyone is aware of specific example in health systems research, please share with us. And then Gumi Abdullah also was discussing as part of his work as in quality improvement in maternal and newborn health, is this an advocacy? Does this topic require advocacy? What aspect of it requires advocacy? So we're doing a lot of back and forth on the chat on that with Gumi, and please also feel free in the discussion time to point to that. And then Patricia Ezekwe mentioned the difficulty of engaging women as stakeholders and how challenging it is to engage women as stakeholders. And of course, Rana and I, as Patricia does too, see the value and the wealth that engaging women is, and as in different contexts where women have traditionally not been engaged, what do you do in such a situation, and how to promote their involvement in advocacy? So we can also discuss that if later on. So, but I just want to go forward now, sort of with the positive note of the power of advocacy, but also what are the various, if you can go next slide, Rana, what are the various issues that we need to be thinking about? So timing is very important, and timing of not only as we reach to the stage of advocacy and activities, but also timing overall of starting and initiating an advocacy campaign. There are a lot of lessons learned in Lebanon for us because of the very turbulent and dynamic changing context that we are continuously living in. It's very important to be on top of the situation in terms of understanding the context and when do you time your advocacy campaign, but specifically then later on, when do you time your advocacy tactics and activities. So before a policy dialogue, being able to implement maybe media engagement activities to ensure that, or at least sort of prime the topic on the policy agenda and incentivize policymakers to take decisions on this, to engage. Rana talked about the value of citizen engagement, to engage citizens and have their approval on policies before starting a national policy dialogue, and have very personalized debriefing with policymakers, potentially supporting the objective of the advocacy campaign, and showcasing citizens' viewpoints. So citizen consultation is important to inform citizens about policy solutions, to get their input and buy-in with regards to policy solutions, but also that information to be portrayed to policymakers so that they know what the positions are of citizens. So successful advocacy campaigns are persistent and using those multiple tactics to identify what tools work better and with what partners is very important. As a communication, we talk about what are target population and how do you communicate with various target populations. In advocacy, who are the stakeholders that we're looking to influence, and what are the most effective tools would be, or activities that need to be held in order to influence the stakeholders and engage with partners. Next. So a few just reflections from our experiences on how to about the experience of stakeholder engagement. And we know, at least for us who've worked with communities, we know the value of trust. Community is one stakeholder. In advocacy, you're working with multiple stakeholders, many stakeholders, and it's it's a time-consuming process that you need to, as an advocate, engage in to gain the trust of various stakeholders. But it's also important to, given that every advocacy campaign requires that you have a set objective, it's also very important to maintain independence and an equal distance from all parties, and basically have the evidence as the guarding shield. So always go back to the evidence. And it was mentioned earlier that often advocacy campaigns are on issues that have that are contentious, and there are a lot of contested debates that people will be coming in and arguments against and for various policies. So it's very important to have use the evidence as a guarding shield and understand in various sectors what could be the internal politics, particularly when we talk about interministerial involvement in a specific policy issue. What are the politics between those sectors? A power analysis is a dynamic process, so that it needs to be conducted at the first stage, but it also can be updated continuously and conducted at multiple stages of or points in time of the advocacy campaign, because positions might be changing as the advocacy campaign unfolds. Very important to understand what people's vested interests are in the topic. I mean, when we engaged in the prevention of childhood obesity, one of our colleagues were asking, who would be against promoting or preventing childhood obesity? Why would there be an issue around, and why would that require advocacy? It seems like this is a very straightforward issue that policymakers will buy into and other stakeholders. So, and in fact, it's not. And this is why it's very important to understand who has vested interests in that. Sometimes these are very exposed and you are aware of, but many times those interests are hidden and it would require time to understand them. Again, identify common goals and values between the sectors and capitalize on the resources that are available in institutions. And this is the value of partnership. So each player or each stakeholder on the table has various resources and strengths. And it's very important to capitalize and leverage on the strengths of stakeholders. And use any success stories and promote or showcase success stories in those sectors. But most importantly, these processes that were described require a lot of patience and the need for partners within the process to be reflective and understand setbacks and realign the strategies that have been put based on revised power analysis in an iterative process. Next. So I usually like to list these 10 lessons learned from advocacy experts, which is from a publication by Simon Chapman, who is a well-known Australian academician and a strong tobacco control advocate, and has published a lot on advocacy and evidence-informed advocacy. First, always respect the evidence, and if the evidence changes, so should your approach or objective. Be clear about what needs to be changed and very specific on what needs to be changed. And what is also important in that aspect is that everybody on the table has the same message and understands and has the same objective and is clear on what needs to be changed and understand that between each other. That sometimes it's important to make noise, so it's better to be looked over than overlooked. So making noise about a topic, whether as part of a strategy to raise awareness, put a topic on the set a topic on the agenda, or move forward a certain policy framework necessary to actually make noise around the topic. In our campaigns that we've been involved in, what that means, Study the Media, is a continuous reporting, understanding of what the media is writing about the topic and the dialogue and the debate around the topic in the media, which is actually a daily activity. So having a regular media check that looks at all media outlets and who's writing about the topic, what sort of issues are being discussed is very important. To use the facts and use the evidence or the epidemiologic facts or the evidence facts in a way that are framed to bring attention. Always to abide and stay in line with the values, public health values, and values in line with values as a public health professional. Experts are important, but experts also their positions are determined by the evidence that's available at a certain point in time. And going back to when we talked about evidence-informed policy, that it does refer to the best available evidence at the time, and so we need to be always ahead of the evidence that is being developed, particularly in long-term advocacy campaigns on topics that require a long-term effort. Advocacy, looking at the evidence and being always aware of the evidence is very important. Now we have social media, and the use of social media is important, but of course, keeping in mind what, in the context that we live in, who uses social media, who's exposed, who has access to social media. Always to feel that that advocacy takes time, and that the last lesson that Simon Chapman mentioned is to grow a rhinoceros hide. So not to take things personal, and always be hard-skinned. I think that's what it means, be hard-skinned in a way to take blows and expect to take blows in and throughout the advocacy campaign. And to reinitiate and move forward a plan. So in our case, you know, what, in a sort of a negative end with regard to the situation in Lebanon on where we are and moving forward in our advocacy, that doesn't mean that this topic, as a public health professionals, we will not move forward, but we will be moving forward with it when the timing allows and the context is feasible. Next. Final take-home messages. It's key that we take up evidence when we talk about advocacy, and not to move forward solutions that haven't been evidenced. That advocacy pushes forward beyond what knowledge translation tools can achieve. And that engaging various stakeholders in these processes, such as citizens and policymakers, will be very important. And depending on the advocacy objective that we set, do we have the time and the resources and the capacity in order to move forward through all the completing the policy cycle, from putting a topic on the agenda to moving forward to formulation, implementation, and evaluating in it. And that these processes require better understanding of the value of what multi-sectoral collaboration brings in. In an example such as childhood prevention of childhood obesity, yes, of course, the Ministry of Health is a valuable partner, the Ministry of Education more so, but there are many other sectors in our context that have a stake in and are required, are needed to collaborate in moving forward any successful advocacy campaign, or any campaign that is aiming to be successful in preventing ultimately the outcome, which is decreasing childhood obesity. Thank you. Thank you. So I'm going to thank you, Rana, and please feel free to unmute yourself for questions. I'm going to open the, you were not probably able to look at the discussion forum, because when you are sharing a slide, it's hard to look at it, but I'm going to open the discussion forum now. And I understand also that participants have the choice to ask questions in person. And I'm looking at the Zoom participant list on the right of the screen to see if there are any hands that are raised, if somebody would like to comment on any material that was presented or has questions. I have posted actually in the discussion forum one manuscript that goes over an advocacy campaign for tobacco control policy, and it's an example if you would like to go through to see another example that's gone through a similar process of advocacy. Rana, would you like to comment on anything or add?
Thank you so much. You've summarized this perfectly, and thank you for the valuable lessons at the end. I'm just looking forward to any questions. Please feel free to unmute yourself or even open your camera for any questions. In the meantime, I guess answering the previous questions would be useful.
Yeah, so the issue of engaging women.
Mm-hmm.
We have experiences in the childhood prevention work that we did.
So what is interesting about having women working in policies and politics is really something that we've always reflected on at the center. First of all, because most of us at the center are female advocates, female policy researchers, or even evidence lead specialists, all working in policy making, and in Lebanon and in the Middle East, or even in so many different contexts. That by itself is a challenge. A woman working in policy is a challenge. But we always have to push through and lead by example, I guess. The other main reflection that we always share at the center is that at every single dialogue that we have, having all the policymakers and the stakeholders and the decision makers, you would be surprised that most of the participants are females. And it's very refreshing to see that women are taking leadership positions in ministries and also in other institutions. And this, at least maybe I'm biased, but at least this has provided a leeway for us, or at least provided some flexibility in the way we approach policies. And in the way that these policies are actually uptaken afterwards. So for some reason, I don't have the evidence about it, but I feel like women in leadership positions are much easier to deal with and to convince and to work with when it comes to public health and human rights, or issues related to the public health field, more than men. But I'm glad to hear also your thoughts about that, Dr. Rima.
Thank you, Rana. Thank you for your perspective. We have two interesting, actually, questions. The first is, or in comments. So the first is a question from Kamling about what were the useful strategies when it comes to some powerful opponents in the government. Any feedback on that? So my take on that, and what from my experience working with opposition in the government, and have had experience working with parliamentarians. So in the tobacco control policy work that I did, I lobbied with parliamentarians in Lebanon, and of course, as you might guess, there's a lot of opposition at that level. There are, and the various strategies, I mean, the strategies that work from my perspective as an academician is coming in as a credible source of evidence from an academic institution that has a history and credibility, and using that evidence with powerful opponents in the government as an academician. But the strategies, and I think Rana can add to that and will agree, is that the strategies will depend on who is actually doing them and who's conducting those strategies. So as an academician, this has been my approach. Civil society groups have used shaming and blaming with governments for different topics. Media have media that are on our side, on the side of, because you could have media that's contributing positively to a campaign and supporting it, and you could have media that is siding with the government and supporting powerful opponents, depending on the country context. I can talk about Lebanon as an example, where media are politicized, so very often you can find this this setting. But the most useful strategies also are who's delivering that strategy, which actually makes a difference. I don't know, Rana, if you would like to add on that for Kamala.
Yes, this is really a very important aspects. And some of other thoughts that we have also engaged with is mainly having a wide network. So those who are within your network and within your coalition can have access to some policymakers if you don't have access to them. So for example, if you have a colleague of yours who is a cousin or a friend or have worked with a previous politician, they could provide you the first point of access with those policymakers, and that would really speed the process for you. That's one thing. The second thing is definitely lobbying. Lobbying is essential with policymakers if they provide you with the time to have a meeting with them. Always in those meetings have fact sheets or one paper summary of your key messages. What do you want them to focus on? And because we've done the power analysis before, we know that what this stakeholder really cares about and what framings they have used before, and use those framings to convince them on why they should be working with you. So use their reasoning for your benefit. Also, the media campaign are really important. When there is discussions in media, policymakers listen. And the last thing that is really important with policymakers is thinking about what is the most important thing for them, and what do they care about the most, which is the being re-elected, right? Which is their public base or of supporters. So if you can engage the public in your advocacy campaigns, have the public share their opinions on a video and then share that video on media campaigns, that would be very powerful and can resonate with policymakers.
Thank you, Rana. And I want to go to the second comment from and question sort of from Zainab. She says that we're aiming to introducing policies to improve health systems through looking and doing social network analysis. And so actually, yes, I mean, conducting the social network analysis, which is actually to understand, the map between and the relationships between the various individuals, groups, and components, and the associations between them is helpful and would inform a power analysis. And if you already are engaged in this work, specifically for in the topic resilience against the economic crisis, it would be valuable to think about, knowing these connections and relationships between the various individuals and groups. How can you make use of that to understand what strategies would be more suitable for which stakeholder, and moving forward in that in an advocacy campaign? So you have part of the work already sort of mapped out for you.
If I could add to this, so network analysis is one of the most powerful tools that you can use in order to identify the power and position of the stakeholders. However, the only downside of that is that it requires some time. And most of the time in advocacy, you just have to quickly work as you move forward with the events. Because if you have to wait, then the window of opportunity that you had might be closed. So the only issue with the network analysis is that it takes time. That's why we resort to power analysis, because it can go much faster. However, if you have the luxury of the time, or if you have available published network analysis done, then you are in a golden position.
Thank you, Rana. I'm looking at if there are any additional questions. Also, I'm looking at the platform. I'm sort of have to jump between one and the other just so that I don't miss any comments or feedback. We have a lot of thank yous about the presentation and for sharing this information on the presentation. And Rana, you've been named as a marvelous, excellent presenter. Also,
thank you.
Because I know you don't have access to the comments to see that.
No, I don't.
I agree with totally. Let me see if there's anything else on the discussion forum, or anybody can, I guess anybody can speak up. You can turn on your mics and cameras to ask questions if you would like. but definitely not the chat via Zoom, because that's disabled. If you want to raise your hand also. Okay, I'm looking. I think I don't see any hands raised at this moment in the Zoom. I don't know, Sinead, if I'm looking at the wrong.
I remember there was one question about a specific policy that someone was working on. We did not answer that, probably.
Yes, so
the early questions.
Let me see if Gumi is still here. Yeah, so one of the topics, which is maternal and newborn health and quality improvement, and the sort of the gist of the discussion is around, what aspect of that would require advocacy, and what specific policy that currently is not in place to promote maternal and newborn health or child health that is evidence-based, that could require an advocacy campaign. And so the discussion was around that, and Gumi was mentioning that perhaps education of the medical sector on various policies that are needed to improve quality is necessary, and there was a lot of back and forth in the discussion around that. So I don't know, Gumi, if you're still here, if you would like to further the discussion via chat. We have a few minutes also, if you would like to do that.
Yes, please, if you would like to, because child and maternal health is a very broad topic, and there are multiple policies that could be discussed, and various contexts might vary. So if you have anything specific in mind that you would like to discuss with us, it would be amazing.
I'm trying to go back and check the chats to remember the details of the discussion.
So in general, once you are working on any advocacy topic, first of all, you have to ask, do I have opposition? Does this topic require advocacy? And when we're talking about education for healthcare professionals for child and maternal health, maybe in some contexts, it does not require advocacy, and all that you need is just provide the evidence of its importance to the relevant stakeholders, maybe just a meeting with a ministry involved, or if it's a syndicate or order that follows up on the credentialing of those healthcare professionals would suffice. In other cases, it might have more opposition if you just understand the landscape better. So it's valuable then to understand the situation to see if there are any opposition that you can advocate. And that's why you should develop also an advocacy plan. But bear in mind that some advocacy campaigns would be very easy to reach if you have very specific goals in mind. If it's a very specific goal, such as, for example, re-credentialing of or continuous education for professionals, it could only suffice with a policy dialogue or some media advocacy or some lobbying. Other situations, other topics requires a lot of advocacy. For example, the infant formula feeding at hospitals and the child-friendly hospital initiative, the implementation of it. That requires a lot of advocacy. Why? Because your main opposition is the industry. And there's a lot published in that sense about different examples of how countries have worked towards banning infant formula or even implementing the hospital-friendly, childhood-friendly initiative. So feel free to also check.
Rana, so just to sort of follow up on what you said, and that's in line with what Gumi also mentioned in the chat, is that the knowledge on how to engage policymakers and stakeholders is missing. It's a missing gap in most of researchers in low middle income countries. So maybe if you can highlight a little bit on how to engage stakeholders through maybe knowledge translation tools that, as you had mentioned, that you might not need the advocacy as such, but there are other ways to engage stakeholders
for that. So actually, this is a very important topic. So just think about it. What is it about the education, right? Who are the stakeholders who are involved in the education? It's probably, depending on your context, the Ministry of Health, the Ministry of Education, if it's the syndicates or the orders who are working in this issue, right? So those are the main stakeholders. Who are they? They are all technical people. You can address them with technical aspects. So just convince them of what they should be working towards, with feasible steps, with solutions that can be implemented and adopted easily, can do a lot of benefit for you. So ideally, in that situation, at least for me, I would see a policy brief or briefing note recommending what are the solutions or what are the recommendations on how to advance on the improvement of the qualifications of healthcare professionals could be very, very important. However, while you're developing this policy brief, you have to engage with those stakeholders themselves in the process from the beginning. If you do that, then you are making sure, first of all, that the policies that you're recommending are properly framed, they are feasible, they are acceptable, and that the stakeholders themselves agree with them and they own those policies with you, right? So you're just the technical expertise supporting and how this policy brief will be written, but the real work or the political navigating around it is done by the stakeholders themselves. And this is really, really important. And what you can further do is have a national policy dialogue or a policy dialogue with those stakeholders who are involved in this issue. So have the nurses or the syndicate of nurses and nurses representatives also in the same room, physicians, midwives, anyone who is involved really in this situation, administrative people in hospitals, in primary healthcare centers, directors of primary healthcare centers. So all of those people are important to be all present in one room, discussing the credentials of the healthcare staff and what are the gaps, what can we do, and what is the way in between in order to reach to where we want to be, right? So is recredentialing every 2 years something feasible in the context? Maybe they would say if yes or no. Is it something about having exams? Is it something about having regular workshops? So those solutions that I'm now mentioning should all be evidence-based. And that is the part of the evidence-based work that you should be working on. So putting on the table the solutions that are evidence-based and back them with enough evidence to support, ideally from systematic reviews, right? So then if I'm suggesting that there should be a credentialing every single year or every 2 years and an exam for those healthcare professionals, I should back this up with all the evidence it needs, with all the benefits, harms, costs, the implementation considerations, so that any question that pops up in that dialogue, I have an answer to. And I have an answer that convinces them based on evidence and based on what worked in different contexts. And that is really important to convince those stakeholders. Once you have all of that figured out as a dialogue, then trust me, the change would be easy for you to persuade and also to reach. I hope this answers your question.
Thank you, Rana. Thank you, Rana. And I would like to highlight a few comments in the last 6 minutes that we have. Felix said, I really enjoyed the session and it resonated with the experience I've been part of as a national advocacy for the enactment of Nigeria's first National Health Act in 2014 and the continuing advocacy for its implementation, especially the special fund for providing access to care for citizens of Nigeria. So I think that the comment and the follow-up with regards to continuing advocacy is a point we also tried to make, that stopping at adopting policy requires one advocacy campaign and is an objective, but going forward in that policy cycle that we talked about. So thank you for mentioning that as an example, as a need to continue to ensure implementation. There's one question that I want to go to address actually before we end with from Tala, which is related to the media. So we mentioned that media, there are different media channels and diversified channels. And she was saying, which media would you rather target, the less biased and objective or most influential, which have bigger audiences? Thinking about Lebanon, would it be more influential to target different media and diversified channels? So I think this is an important question in the context of Lebanon and also perhaps other countries that have strong media and media presence. In this case, it depends on the topic and it depends on engagement. You know, engaging media, you cannot really control what media end up deciding to expose. And so from our experiences, yeah, we've had a very good relationship with media who speak the same language and actually write about, you know, the advocacy campaigns and promote positions, public health positive positions. And others that those that are or influenced or have alternative agendas, or in the case of contentious issues, and at least in the case of, you know, alcohol policy, tobacco policy, even food policies, where there are strong and powerful industries who are interested in promoting their shareholders' profit rather than upholding public health values. Those industries have been, and that is actually reported and documented in peer-reviewed manuscripts, have been very effective in manipulating and in placing stories in media channels, paid stories in media channels, and in influencing journalists and media outlets. So it's a very sensitive sort of approach, needs to be very sensitive, but your power analysis and your continuous reflection on your power analysis on where do these media outlets and channels, where they are in terms of being with, opposing, or with, and how powerful they are, will be your guide to thinking of how to and who to target with and who to work with. Rana, would you like to add a final note on this, because we're closing in 3 minutes?
Yeah, so one very useful thought on how to engage with media is first to figure out, are they a vehicle for you in your campaign to just show up or show your information that you want to share, or are they really an actual stakeholder? Do they have a say, or are they really a player in your context? So for example, in the context of tobacco in Lebanon, we know that one prominent, for example, media personnel is supportive somewhat of the syndicate of the hospitality sector, and they show them always in their interventions, and we know then that media can be a player in the field rather than just a vehicle of sharing your information. So that's why the power analysis tool is very, very important for you in order to identify who are the key media personnel, what are the key platforms that always share on the topic, who are always interested, but keep in mind how they share about it and the framing, what resonates with them, what impacts them, and reach to them in that sense. Always be careful when you're sharing with media, because they tend sometimes to change the way what you're saying or reinterpret it. So be very clear in your messages. For example, in some instances, I've been quoted in newspaper wrongly, even in quotations. So you have to be very careful in what you share with them, be very specific, use lay language in order for them not to interpret it in any other way than the way that you want them to be interpreting it. So those are the main thoughts. I know we are short in time, but I think there is a question that we did not address. It's about the public is one important stakeholder in the aspect of communication. What are some of the important lessons you learned and trickling down effective information to the public? Do you want to start with that quickly?
Yes, I think working with you, so public, we've engaged the public through media and through citizen engagement forums, and what one of the important lessons is how valuable the public feel and see the engagement in policy issues, and how they see necessary their engagement is in policy issues. And one of the main important lessons learned in this is that, you know, to give time to citizen engagement and give time to informing the public, because and the scope of involvement and how big the scope of involvement is time consuming, but also resource intensive. And so if there is from the team an interest and commitment to do that, it's very important to allocate the time and the resources that are needed for the public as an important stakeholder.
Exactly. I would only add 2 words: trust. So help people trust you and on how you're moving forward with this, and also the methods. So data visualization and methods in order to communicate health messages easier for the public, for them to understand, is key. Right on time. Thank you so much, everyone, for joining.
Thank you everybody, and thank you for joining our session and allowing us to share. Thank you.
Thank you, everyone.
Thank you. Thank you.
Bye-bye.
Bye.